The ER doors slammed open at 3:47 a.m. Dr. Richard Pemberton didn't look up from his chart. He'd seen 1,000 arrivals like this, heard 1,000 footsteps that thought they mattered. These ones were different, controlled, measured, no hesitation. Dr. Samantha Graves crossed the threshold with her surgical cap already tied, scrubs wrinkled from a double shift she hadn't been scheduled for. Her hands moved to the sanitizer dispenser without looking. Muscle memory, the kind that comes from repetition under conditions most people only see in nightmares. Pemberton glanced up. His pen stopped mid-signature. She was early. Again. 6 months into her contract as junior attending, and she still acted like she had something to prove. He found it irritating. Desperation dressed up as diligence. Dr. Graves. His voice carried across the bay, flat, administrative. "You're not on until 6. She didn't break stride. Heard the scanner. Multi-vehicle pileup on the I-5. Figured you'd need hands. We have residents for that. Residents are in lecture until 5. Pemberton's jaw tightened. Technically correct, functionally insubordinate. She moved past him toward the trauma bays, already scanning the board. Her eyes tracked patient names, bed assignments, incoming EMS alerts, processing, prioritizing. He'd seen that look before, on surgeons who thought they were too good for protocol, on hotshots who burned out by 40, on people who didn't belong in academic medicine. Dr. Graves. She stopped, turned. "This isn't a field hospital. We follow procedure here, chain of command. If I need you, I'll page you." Something flickered behind her eyes, not anger. Something older, colder. Understood. She turned back toward the resident lounge. Pemberton returned to his chart. The radio crackled. "Mercy General, this is Medic 7. We're 3 minutes out. Male, mid-20s. Ejected from vehicle, GCS 6, significant head trauma. Medic 9 is right behind us with a pediatric code, and Medic 12 has 2 criticals from the same scene. You're gonna need everyone you've got." Pemberton's pen stopped again. The charge nurse, Joel Raines, looked up from the central station. Former Navy corpsman, 20 years in ERs after 8 at sea. He knew what 3 rigs meant. "Want me to pull Graves back in?" Joel's voice was even. No judgment, just the question. Pemberton hesitated. Pride had a price. So did ego. "Fine, get her. And wake up Mansour. Tell him we need cardiothoracic on standby." Joel nodded and moved. 60 seconds later, the first gurney crashed through the doors. Sam was already there. She didn't run, didn't shout, just stepped into position at the head of the bed as the paramedics rattled off vitals. 24-year-old male, unrestrained driver, ejected at speed. GCS dropped from 9 to 6 en route. Pupils sluggish. BP's holding at 90/60, but he's tacky at 140. We've got 2 large bores running wide open. Sam's hands were already moving. Pen light out. Pupils checked. Both reactive, but the left was slower. Her fingers moved to his neck. Palpated, gentle but certain. Trachea's midline. No crepitus. Breath sounds? Diminished on the right. She leaned in. Listened. Pulled back. Possible pneumo. Get me a chest x-ray and trauma labs. Type and cross for 6 units. Joel was already moving. Dr. Lena Park, a third-year resident, hovered near the foot of the bed. Eager, nervous. "Dr. Graves, should we intubate?" Sam's eyes didn't leave the patient. "Not yet. His GCS is borderline. And if we drop his pressure during induction, we lose him. We stabilize first. Tube second." Lena nodded. Tried to absorb the logic. Pemberton stood 3 feet away, watching, arms crossed. The second gurney arrived. Pediatric. A girl, maybe 9 years old. Her mother was in the 3rd rig. Sam's eyes flicked toward the new arrival. Calculated. She saw the resident freeze. Saw the paramedic's face. That look. The one that said they'd already done everything they could. The girl's chest wasn't moving right. Sam's voice cut through the noise. Calm. Clear. "Joel, take over here. Monitor neurostatus and get that x-ray. If his GCS drops below 5, you tube him. Don't wait for me." Joel stepped in without a word. Sam moved to the girl. The room shifted. Pemberton's eyes narrowed. She wasn't supposed to do that. Wasn't supposed to override the chain. The attending on deck was supposed to delegate, supervise, not jump in. But she was already at the child's side, hands on the chest, feeling for rise, for symmetry. Flail chest, left side, at least 3 ribs. The paramedic blinked. "We didn't catch that." "You wouldn't. Not under the blankets and with this much movement. Her hands moved lower. Abdominal palpation. Quick. Systematic. She's guarding here. Possible splenic injury. Get me an ultrasound and activate the OR. She's going up. Lena stared. How do you know? Because she's compensating. Heart rate's 160 in a kid this size. She's bleeding somewhere we can't see yet. The ultrasound cart rolled in. Sam took the probe, moved it across the girl's abdomen with the ease of someone who'd done it 1,000 times in worse conditions. There, free fluid, dark, pooling in the left upper quadrant. She's got a splenic lac. We need surgery now. Pemberton stepped forward. Dr. Graves, you don't have the authority to. Then get someone who does. Because in 5 minutes, she's going to code, and we'll be doing a crash lap in the ER instead of a controlled repair upstairs. Silence. Pemberton stared at her. She stared back. Joel's voice broke the standoff. X-rays up on the first guy. Right pneumothorax. Moderate. He's still stable. Sam didn't look away from Pemberton. Your call, doctor. He turned to the charge nurse. Activate the OR. Sam moved. Before we go further, let me ask you something. Where are you watching from right now? Are you in the medical field? Have you ever seen someone who just knew what to do, even when no one else did? Drop a comment below and tell us. And if you want to see what happens when the real crisis hits, when Dr. Graves' past catches up with her in a way no one in that hospital is ready for, make sure you subscribe to Emergency Heroes Stories. Because what she does in the next few minutes will leave you speechless. The girl was intubated in 90 seconds. Stable enough to move, the gurney rolled toward the elevator. Sam stood in the trauma bay, alone now, blood on her gloves, the controlled chaos ebbing around her. Pemberton watched from the corridor. He didn't say anything, but he saw the way she moved, the way she knew. And for the first time in 6 months, he wondered what he didn't know about Dr. Samantha Graves. The resident lounge smelled like burnt coffee and old takeout. Dr. Lena Park sat at the corner table, still running on adrenaline from the night shift. Across from her, 2 other residents picked at vending machine pastries and talked in low voices. I'm telling you, she's not normal. That was Dr. Ben Holloway. 2nd year. He had the look of someone who'd been awake for 30 hours and was using gossip as a stimulant. Lena frowned. What do you mean, not normal? Graves, you saw her tonight. She walked into that trauma bay like she'd already written the script. Flail chest, splenic lac, the whole thing. Before imaging. Before labs. That's called clinical judgment, Lena said. That's called something else. Ben leaned forward. You know she doesn't socialize, right? Doesn't go to department meetings unless Pemberton makes her. Doesn't talk about where she trained. I looked her up. She did her residency at some nobody program in New Mexico. Military hospital liaison or something. No publications. No research. How does someone like that get hired at a level 1 trauma center? The 3rd resident, Maria Okonkwo, set down her coffee. Maybe she's just good at her job. Or maybe she's hiding something. Lena felt the discomfort creep in. She didn't like gossip, but she couldn't shake the image from earlier. The way Dr. Graves had moved, the certainty. She did save that kid, Lena said quietly. Yeah, she did. Ben's voice softened. I'm not saying she's bad at what she does. I'm saying she's too good, and nobody knows why. Maria glanced toward the door. Maybe we should just ask her. Good luck with that. She doesn't exactly do small talk. Lena stood, tossed her cup into the trash. I'm gonna get some sleep. You two can speculate all you want. She left, but the question stayed with her. 2 floors up in the surgical wing, Dr. Akhtar Mansour was closing the pediatric case. The girl's spleen had been a mess, shattered in 3 places. He'd spent an hour trying to salvage it before making the call to remove it entirely. Standard procedure. Clean work. But he kept thinking about the ER doctor who'd caught it. Most attendings wouldn't have pushed for imaging that fast, wouldn't have trusted their gut over protocol. Graves had. And she'd been right. He tied off the final suture and stepped back. The OR nurse began the count. Mansour pulled off his gloves and left the room. In the scrub area, he found Joel Raines restocking supplies. Joel, the nurse looked up. Doc, the attending who called the splenic lac. Graves, you work with her much? Joel's face stayed neutral. Some. What's your read on her? Joel dried his hands, took his time answering. She's solid, doesn't waste words, doesn't waste movement, sees things other people miss. That's not an answer. Joel met his eyes. You asking if she's competent, or you asking something else? Mansoor hesitated. I'm asking why someone with her instincts is working as a junior attending in a teaching hospital. She should be running a trauma unit somewhere. Joel folded the towel. Maybe she doesn't want to run anything. Maybe she just wants to do the work. Or maybe she's running from something. Joel didn't reply. Mansoor left. But the question lingered. By noon, the hospital had shifted into its daytime rhythm. Calmer, more controlled. Sam sat in the attending's office, finishing notes from the morning's cases. Her handwriting was efficient. Each sentence clipped and precise. The door opened. Dr. Pemberton stepped inside. He didn't sit. The girl's stable. Mansoor says she'll recover fully. Sam nodded, kept writing. You made the right call. She looked up. Pemberton's expression was unreadable. Not quite approval, not quite suspicion. You have good instincts, Dr. Graves. Better than most people at your level. Thank you. Where do you train? The question hung in the air. Sam set down her pen. New Mexico, Military Medical Liaison Program. And before that, I worked in field hospitals, trauma stabilization. Military field hospitals. It wasn't a question. Sam met his gaze. Yes. Pemberton crossed his arms. How long? 8 years. Combat? Some. What branch? Army. He waited for more, she didn't give it. You don't talk about it much. It's not relevant. Isn't it? Pemberton stepped closer. You move like someone who's worked under fire. You make decisions like someone who's had to choose between bad options and worse ones. That's not something you learn in a residency program. Sam's jaw tightened. I learned it by doing the job. Same as everyone else. No, not the same. Silence. Pemberton's pager buzzed. He glanced at it, frowned. We'll talk later. He left. Sam exhaled slowly. Her hands were steady, but her pulse wasn't. She rolled down her left sleeve. The tattoo was covered. It always was. That evening, the ER was quiet, a lull between storms. Lena found Sam in the med room, restocking her trauma bag. It was a habit most attendings didn't bother with. The nurses did it, but Sam always checked her own supplies. Dr. Graves? Sam looked up. I just wanted to say thank you, for earlier, for showing me how to see what I was missing. Sam's expression softened slightly. You'll get there. It just takes repetition. How much repetition? Enough that you stop thinking and start seeing. Lena hesitated. Can I ask you something? Sam waited. Where did you work before here? Field hospitals, overseas, combat zones? Sam's hands paused on the bag, just for a second. Yes, that must have been hard. It was necessary. Lena wanted to ask more, wanted to understand the distance in Sam's voice, the way she said necessary like it was the only word that mattered. But the radio crackled. Mercy General, this is Medic 4. We've got an NVC, single vehicle rollover. Driver stable, but we've got a passenger. Older male, possible cardiac event. ETA, 4 minutes. Sam closed the bag. Let's go. They moved toward the trauma bay. Lena felt the shift. The way the air changed when Dr. Graves walked into a room, like someone had turned on a switch. And for the first time, Lena wondered what it would take to become that certain. The ambulance pulled in. The paramedics unloaded the gurney. The patient was older. Silver hair, maybe 60. His face was pale, but his eyes were sharp. Sam stepped to the side of the bed, started her assessment. The man's gaze drifted to her hands as she reached for the IV line. His eyes stopped, focused. On her left forearm, on the edge of black ink, just visible beneath her sleeve. His breath caught. Sam didn't notice, but Joel did. He saw the way the man stared, the way his lips parted like he was about to say something. Then the monitor beeped. Sam's attention snapped to the screen. VTAC, get the crash cart. The moment passed, but Joel kept watching the old man's face, and he knew. Somehow, that patient recognized her. The crash cart arrived in seconds. Sam's hands moved without hesitation. She grabbed the defibrillator paddles, checked the charge, and positioned them over the man's chest. Clear. The body jolted. The monitor screamed, then settled into a rhythm. Normal sinus. She exhaled, set the paddles down. Her fingers went to his neck. Carotid pulse. Strong, steady. Push 1 milligram epinephrine. Get me a 12-lead EKG and cardiac enzymes. I want a portable chest x-ray now. Lena moved fast. Joel was already pulling the EKG machine into position. Sam leaned over the patient. His eyes were open now, focused, clear. Sir, can you hear me? He nodded. His voice came out rough, hoarse from the intubation attempt the paramedics had prepped for. Where am I? Mercy General. You were in a car accident. You went into an arrhythmia, but you're stable now. We're going to run some tests. His gaze drifted again, to her arm. She noticed this time, pulled her sleeve down slightly. A reflex. His lips moved. Barely audible. Gravedigger. Sam froze. Joel's head snapped up. Lena didn't hear it. She was too focused on placing the EKG leads. Sam's voice dropped. Quiet, controlled. What did you say? The man's eyes locked on hers. He tried to sit up. She placed a hand on his shoulder, firm but gentle. Sir, you need to stay still. You're her. His voice cracked. You're Gravedigger. The room felt smaller. Joel stepped closer. His instincts were sharp. 20 years sharp. Sam's face didn't change, but her hand on the man's shoulder tightened. I don't know what you're talking about. You've just had a cardiac event. You're confused. I'm not confused. His hand reached for hers, gripped it. His fingers were cold, trembling. Helmand, August 14th, 2014. Sam's breath stopped. Joel saw it, saw the flash of something behind her eyes, something she'd buried deep. Sir. Her voice was steady, too steady. You need to rest. We'll talk later. You saved my life. He pulled her hand back, stepped away. Lena, finish the workup. I need to check on another patient. Lena looked up, confused. Dr. Graves, You've got this. Sam turned and walked out. Joel watched her go, then looked back at the man on the gurney. The old soldier's eyes were wet. That's her, he whispered. That's the one who wouldn't let us die. Joel moved closer, kept his voice low. Who are you? Colonel Marcus Wade, retired, Army Rangers. Joel's expression shifted. He'd seen enough veterans to know the look, the weight. You know Dr. Graves? Wade nodded. She was attached to my task force, combat medic, then field surgeon. Best I ever saw. She doesn't talk about it. She wouldn't. Wade's hand went to his chest. She thinks she failed us. Did she? Wade's voice broke. She's the only reason any of us made it home. Joel stood there, processing. Then he left to find Sam. She was in the stairwell, sitting on the bottom step, head in her hands. Not crying, just still. Joel didn't say anything at first, just sat down next to her. He knows you. Sam didn't look up. Yeah. He says you saved his life. I did my job. He called you Gravedigger. She flinched. Joel waited. It was my call sign, she said finally. Field surgeon. They called me that because I kept pulling people back from the edge. That's a hell of a name. It's a dead name. Silence. Joel leaned back against the wall. You planning to go back in there? Eventually. He's stable. Lena's got him. Sam nodded. Joel stood. For what it's worth, whatever you did back then, it's still who you are now. You can't run from that. He left her there. Sam sat alone in the stairwell for 3 more minutes. Then she stood, rolled her shoulders, pushed the door open, walked back into the ER. Wade was sitting up now. The EKG was done. The labs were pending. Lena stepped aside when Sam approached. Sam pulled up a stool, sat down at eye level with him. Colonel Wade. He smiled. Faint. Tired. You remember. I remember. I've been looking for you. Why? Because you disappeared. One day you were there. Next day you were gone. They said you took a discharge. Nobody knew where you went. Sam's jaw tightened. I needed to leave. Because of what happened. Because I couldn't do it anymore. Wade reached for her hand again. This time she let him. You saved 6 of us that day. Kept us alive for 11 hours while we waited for exfil. You worked on all of us, simultaneously, under fire. I watched you stop my bleeding with one hand, while you intubated Sergeant Carver with the other. You were all critical. And we all lived. Her voice dropped. The mission failed. The mission was compromised before we ever landed. Intelligence failure, nothing you could have stopped. I should have seen it. You're not intelligence. You're a surgeon. His grip tightened. And you were the best I ever served with. Sam's throat tightened. She pulled her hand back. Your EKG shows ST elevation. You're having a STEMI. We need to get you to the cath lab now. Wade blinked. What? You're having a heart attack. Active. Right now. Lena's eyes went wide. She looked at the EKG printout. I didn't see. Sam pointed to the strip. There. Lead 3. Subtle, but it's there. And his enzymes are going to come back elevated. We need to move. She stood. Raised her voice. Joel, call the cath lab. Tell them we've got a STEMI coming up. Get cardiology down here now. Joel grabbed the phone. Wade stared at her. You just saved me again. Sam didn't respond. She was already moving, checking lines, prepping the gurney for transport. Dr. Mansour arrived 4 minutes later. Looked at the EKG. Looked at Sam. How did you catch this? Experience. This is a posterior MI. Most people miss it. I didn't. Mansour nodded. Respect in his eyes now. Let's get him upstairs. The gurney rolled. Led toward the elevator. Wade reached out, grabbed Sam's wrist as they moved. Don't run anymore. She didn't answer. The elevator doors closed. Sam stood in the hallway, alone again. Lena approached carefully. Dr. Graves, that was incredible. I completely missed that. You'll learn. How did you see it? Sam looked at her. Because I've seen 1,000 ways people die, and I've learned to see the ones they don't have to. She walked away. Lena stood there, trying to understand. Joel watched from the nurse's station. He pulled out his phone, searched for something. A military database. Public records. He typed, Captain Samantha Graves, Army, 2014. The results loaded. One entry, Silver Star recipient. Citation, Extraordinary Heroism Under Fire. Helmand Province, August 14, 2014. Joel set the phone down. Now he understood. And he knew the whole hospital was about to find out. The call came at 6:32 p.m. Every radio in the hospital crackled at once. All units, mass casualty incident, construction site collapse, downtown, steel beam failure, multiple critical traumas inbound, estimated 15 to 20 patients. ERs citywide are receiving. Mercy General, your primary intake. First Rigs ETA 7 minutes. The overhead PA system echoed the alert. Code triage. All available personnel to emergency. Code triage. Sam was in the locker room, changing into fresh scrubs after a 12-hour shift that had turned into 16. She heard the call, stopped, pulled the scrub top over her head, and moved. The ER transformed in seconds. Nurses cleared beds. Residents appeared from every floor. Attendings canceled clinics. The trauma bays expanded into the hallways. Pemberton stood at the command board, dry erase marker in hand, assigning roles. Mansour, you've got surgical backup. Park, you're on airway management. Holloway, take the walking wounded. Graves, she was already at his side. He looked at her, saw the focus in her eyes. Bed 3, moderate traumas, stabilize and pass them up. Understood. The first ambulance arrived, then the second, then 5 more. The noise was immediate. Voices shouting, gurneys rolling, monitors beeping, the metallic smell of blood mixing with concrete dust and sweat. Sam moved to bed 3, a man in his 40s, construction worker, hard hat cracked in half. Face covered in dust and blood. Fell 2 stories when the beam gave out, the paramedic said. GCS 13, possible spinal involvement. He's got movement in all extremities, but he's complaining of back pain. Sam's hands went to his neck. Palpated the cervical spine, methodical, gentle. Any numbness or tingling? The man shook his head. Just hurts like hell. We're going to get you imaging. Don't move. She turned to Lena. See spine protocol. Get him a CT. Fast. Lena nodded and moved. Sam stepped to the next bed. A younger guy, maybe 25. Conscious, breathing fast, pale. Crush injury to the left leg, the paramedic said. Beam pinned him for about 20 minutes before they got it off. Distal pulse is weak. We started fluids wide open. Sam pulled back the blanket. The leg was mangled, tibia visible through the skin, but the bleeding was controlled. She pressed her fingers to the foot, checked capillary refill. Slow, too slow. Get ortho down here. Tell them possible compartment syndrome. This leg needs a fasciotomy within the hour, or he loses it. The paramedic blinked. We didn't think it was that bad. It is. She moved on. Bed after bed, patient after patient. Fractured ribs, pneumothorax, concussions, lacerations. A dislocated shoulder she reduced in 30 seconds while the patient screamed and then sighed in relief. Sam didn't stop, didn't slow. Her hands moved. Her mind calculated, triage, stabilize, move. This was the rhythm she knew, the one burned into her from years of working in places where hesitation meant death. Then the double doors opened again. This one was different. The paramedics moved faster, their faces tight. "Trauma 1, the lead medic shouted. "Male, late teens, rebar through the chest. Entering just below the left clavicle, exiting posterior near the spine. We couldn't remove it on scene. Building debris was resting on the bar. Patient's been stable, but he's starting to drop. BP's 85/50. Heart rate 130. Pemberton's head snapped up. "Get him to trauma 1. Mansour, you're up." The gurney rolled in. Sam saw it from across the room. The kid couldn't have been more than 17. His eyes were wide, scared. The rebar jutted from his chest like a flagpole. A section of it still had concrete attached. Mansour arrived, took one look. His face went pale. "We can't move this in the OR. If we shift him wrong, that bar could sever the subclavian or nick the aorta. We need vascular. We need cardiothoracic. We need to move now," San said. She was at the bedside. Pemberton turned. "Dr. Graves, this isn't your case." "It is if he's going to live." Mansour stared at her. "You can't extract this here. It's too close to major vessels. If it shifts even a centimeter, then we don't let it shift. This requires an OR, full imaging, a team. He'll code before you get him upstairs." Sam's voice was flat. "Absolute. Look at him, he's compensating. Another 5 minutes and his pressure drops below 70. Then you're doing CPR with a steel bar through his chest." Mansour hesitated. Sam didn't. She turned to Joel. "Get me a vascular clamp set, fully catheter, largest bore you have, 2 units O negative on standby, and I need a portable ultrasound here now." Joel moved without question. Pemberton stepped forward. "Dr. Graves, you don't have the authority." "Then stop me." She pulled on gloves, moved to the head of the bed. The kid looked up at her, tears streaming down his face. "Am I going to die?" She met his eyes. Her voice softened, just slightly. "Not if I can help it." The ultrasound arrived. Sam took the probe, ran it along the entry point, watching the screen. There, the rebar was a millimeter from the subclavian artery, a hair's breadth from the lung. If it moved, he was gone. "I need everyone quiet," Sam said. "No one touches this gurney. No one bumps this bed. We work around him. Understood?" The room went silent. Lena stepped closer, whispered, "Dr. Graves, what are you going to do?" Sam's eyes didn't leave the screen. "Something I learned a long time ago." She turned to the crowd forming around the bed. Pemberton, Mansour, Joel, Lena, 3 other residents. "This is called a controlled corridor extraction. It's a battlefield technique for penetrating foreign objects near critical vessels. I'm going to create a vascular corridor using balloon occlusion, extract the rebar in one motion, and repair any damaged tissue simultaneously." Mansour's eyes widened. "That's experimental. There's no protocol for—" "There is, just not here." Sam's voice carried across the room now. "I was a combat surgeon, Army, 8 years, 4 deployments. I've done this procedure 17 times in field hospitals under worse conditions than this." The room went still. Pemberton stared at her. Lena's mouth opened. Joel smiled slightly. Sam didn't wait for permission. "Joel, I need that Foley now." He handed it to her. She prepped the catheter, inflated the balloon, positioned it. "I'm going to thread this along the rebar tract. When I inflate it inside, it'll occlude the subclavian temporarily. Give me a 30-second window to extract and clamp." She looked at Mansour. "I'll need your hands. You clamp the vessel the moment I pull the bar. Understood?" He hesitated, then nodded. Sam positioned herself. 1 hand on the rebar, 1 hand on the catheter. "On my count. 3, 2, 1. She moved. The catheter slid into place. Balloon inflated. She gripped the rebar, pulled, smooth, even, no hesitation. The steel slid free. Blood erupted. Mansour's hands were already there, clamp in place. Sam's fingers moved faster than anyone had ever seen. Suturing, controlling, sealing. 15 seconds, 20, 30. The bleeding stopped. The monitor beeped. Steady rhythm. Blood pressure held. Sam stepped back, pulled off her gloves. A kid was still alive. The room exhaled. Mansour stared at the closed wound, then at Sam. "Where the hell did you learn that?" Sam's voice was quiet, tired. Helmand Province. When you don't have an OR and the next medevac is 2 hours out, you improvise. She turned and walked toward the scrub sink. Behind her, the room stood frozen. Pemberton's face was unreadable. Lena looked like she'd just seen someone walk on water. And Joel, standing at the back, pulled out his phone, opened the search he'd done earlier, turned the screen toward Pemberton. Silver Star. Captain Samantha Graves. Pemberton read it, then looked up at Sam's retreating figure. For the first time in 6 months, he realized he'd been wrong. The hospital had quieted by midnight. Most of the construction site patients were stable. The critical ones were in surgery or ICU. The kid with the rebar was in recovery. Vitals strong, prognosis good. Sam sat in the attending's office, alone, staring at a blank progress note on the computer screen. Her hands rested on the keyboard, but didn't move. The door opened. Pemberton. He closed it behind him. Didn't sit. Just stood there, with his arms crossed. "We need to talk." Sam didn't look up. "About what?" "About the fact that you just performed an unorthodox surgical procedure in my ER without authorization. The patient is alive. That's not the point." She finally turned, met his eyes. "Then what is?" Pemberton stepped closer. His voice dropped, controlled but edged with something sharper. "The point is that you've been working here for 6 months, and I didn't know you were military. I didn't know you were a combat surgeon. I didn't know you had a Silver Star. It wasn't relevant." "Wasn't relevant?" His voice rose slightly. "You let me treat you like a liability, like someone who didn't belong here. And the whole time, you were more qualified than half my senior staff." Sam's jaw tightened. "I didn't let you do anything. You made assumptions. Because you let me." Silence. Pemberton sat down, rubbed his face. "Why didn't you tell me?" "Because I didn't want to be defined by it." "By what? Your service? Your record?" "By what happened." Her voice was quiet, flat. Pemberton leaned forward. "What happened?" Sam looked away. "I did my job, then I left." "That's not an answer. It's the only one you're getting." He studied her, saw the wall, the distance. "Joel showed me your citation. Helmand Province, August 2014. You kept 6 soldiers alive under fire for 11 hours. That's not just doing your job. That's heroism. It was survival. For them, not for you." She didn't respond. Pemberton's tone softened, just slightly. "Look, I'm not trying to dig into your past, but if you're going to work here, I need to know what I'm working with. What you're capable of. What you've been through. You saw what I'm capable of tonight." "I saw a fraction." He paused. "And it scared the hell out of me. Not because you did something wrong. Because I realized I've been underestimating you from day one." Sam finally looked at him. "So now what?" "Now I'm asking you directly. Why are you here? Why a teaching hospital? Why not a trauma unit? A military liaison position? Doctors with your experience don't take junior attending roles. Maybe I wanted something quieter. You don't strike me as someone who does quiet." She stood, moved toward the door. "Dr. Graves." She stopped, hand on the doorknob. Pemberton's voice was steady, firm. "I'm not your enemy, but I need to know who." "Who you are, because after tonight, the whole hospital is going to be asking questions. And if you don't give them answers, they'll make up their own." Sam turned. Her eyes were hard. "I served 8 years, 4 combat deployments. I was good at what I did. Then something happened that made me realize I couldn't do it anymore. So I left. I went to medical school, did my residency, and now I'm here. That's all you need to know." "What happened?" Her hand tightened on the doorknob. "I lost people I couldn't save, and I decided I was done losing people." Before Pemberton could respond, the overhead PA crackled. "Dr. Graves to Trauma 1. Dr. Graves to Trauma 1. Immediate." Sam was out the door before the announcement finished. Pemberton followed. Trauma 1 was chaos again. A gurney in the center, compressions in progress, monitor screaming. Lena was at the head of the bed, bagging the patient manually. Her hands were shaking. "What happened?" Sam's voice cut through the noise. "Post-op bleed," Lena said, breathless. "The rebar patient. He was stable in recovery. Then he crashed. We think he's bleeding into the chest. He arrested 2 minutes ago." Sam stepped to the bedside. looked at the monitor. Flatline. She placed her hands on his chest, felt for the incision, pressed gently. Blood seeped through the dressing. He's got a delayed bleeder. Probably a small vessel we missed. Get me a thoracotomy tray. Now. Mansour appeared at her side. We need to get him back to the OR. He won't make it. We quack in here. Here? In the ER? Yes. She pulled on gloves. Joel was already at her side with the tray. Sam didn't wait. She prepped the chest, scalpel in hand. Lena, keep bagging. Joel, I need suction and clamps ready. She cut. The incision opened. Blood welled up. She suctioned. Moved deeper. Her hands disappeared into the chest cavity. Searching. Feeling. There. She clamped. Tied off. Moved to the next bleeder. Another clamp. Another tie. The blood slowed. Stopped. She pulled back. Resume compressions. Joel took over. 30 compressions. 2 breaths. The monitor flickered. A blip. Another. Then a rhythm. Sinus tachycardia. Fast but regular. The room held its breath. The kid's chest rose. Fell. Rose again. Sam stepped back. Blood covered her hands, her scrubs, her arms. She looked at the monitor. Stable. Mansour stared at her. You just did an emergency thoracotomy in the ER. I did what was necessary. That's not protocol. Protocol would have killed him. Pemberton stood in the doorway, watching. He didn't say anything. Lena was crying. Elith. Exhaustion. Awe. Dr. Grades, how did you know where to cut? Sam pulled off her gloves. Because I've done it before. Too many times. She moved to the sink. Washed her hands. The water ran red. Behind her, Joel spoke quietly. You saved him twice in one night. I just didn't let him die. That's the same thing. She dried her hands. Turned. The room was still staring. Sam's voice was steady. Tired. He needs to go back to the ICU. Monitor him closely. If there's any sign of rebleeding, page me immediately. She walked out. Pemberton followed her into the hallway. Dr. Grades. She stopped. Didn't turn. That was extraordinary. That was training. No, his voice was firm now. That was something else. That was someone who's seen the worst and refused to accept it. Sam turned. Her eyes were red. Not from tears, from exhaustion, from years of carrying weight no one else could see. I've spent 10 years trying to forget what I saw, what I did, and every time I think I'm past it, something like this happens and I'm right back there. Back where? Helmand, August 14th. 6 soldiers bleeding out in front of me. No backup, no supplies. Just me and a medic kit, and 11 hours of hell. Her voice cracked, just slightly. I kept them alive, all of them. And when it was over, they gave me a medal and told me I was a hero. But all I could think about was how close I came to losing every single one of them. Pemberton didn't move. Sam's hands were shaking now. So I left, because I couldn't do it anymore. Couldn't carry that weight. I thought if I came here, if I worked in a place where I had resources and time and support, maybe I could save people without feeling like I was 1 second away from failure. And tonight I realized it doesn't matter where I am, the weight's still there. Pemberton stepped closer. His voice was quiet, respectful. Then maybe you stop trying to run from it. Maybe you use it. Sam looked at him. You have a gift, Dr. Graves, a skill set most doctors will never have. You see things others miss. You act when others freeze. That's not something to hide. That's something this hospital needs. I'm not a hero. No, you're a surgeon, a damn good one. And it's time you stopped apologizing for it. Before she could respond, her pager buzzed. She looked down. ICU, Colonel Wade, awake and asking for her. She looked at Pemberton. He nodded. Go. She left. Walked through the quiet hallways toward the ICU, each step heavier than the last, because she knew what was coming. The conversation she'd been avoiding for 10 years, the one that would force her to face what she'd left behind. The ICU was dim, quiet except for the rhythm of ventilators and monitors. Sam stood outside Colonel Wade's room, watched him through the glass. He was awake, sitting up slightly, tubes and wires connected to his chest. But his eyes were clear. He saw her, raised a hand, gestured for her to come in. She pushed the door open, stepped inside. Colonel. Captain. His voice was rough but steady. Or do you go by doctor now? Just Sam. He smiled faintly. I never called you Sam. Always Graves. or gravedigger when things got bad. She pulled a chair close to the bed, sat down. How are you feeling? Like I got hit by a truck, but alive. Thanks to you, again. Sam looked at the monitor, checked his vitals. A reflex. Your heart's stable, the stent is in place. You'll need medication and lifestyle changes, but you'll recover. I know. Mansoor already gave me the speech. Wade paused. But that's not why I ask you here. Sam's hands folded in her lap. She didn't respond. Wade shifted slightly, winced. I've been looking for you for 10 years. You said that. Do you know why? She didn't answer. Because you disappeared. One day you were there, the best combat surgeon I'd ever worked with. The next day, gone. Discharged. No forwarding address. No contact. Like you vanished. I needed to leave. Because of Helmand. Her jaw tightened. Wade's voice softened. Sam, what happened that day wasn't your fault. 6 men nearly died. 6 men lived. Because of you. They shouldn't have been in that position in the first place. No, they shouldn't have. Wade leaned forward, locked eyes with her. And that wasn't on you. That was on intelligence, bad intel, compromised source. We walked into an ambush because someone upstream screwed up, not you. Sam's voice was barely audible. I should have seen it coming. You're a surgeon, not a strategist. Your job was to keep us alive, and you did. She looked away. I remember every second of those 11 hours. Every face, every wound. Carver's collapsed lung. Daniel's with the femoral bleed. Your subclavian artery. I remember too. I remember you working on all of us at once, hands covered in blood, talking to us, keeping us conscious, refusing to let any of us slip away. I was terrified the entire time. We all were, but you didn't show it. You just kept working. Sam's hands clenched. When the medevac finally arrived, I collapsed. I couldn't move, couldn't speak. They had to carry me out. Wade nodded slowly. I know. I saw them load you onto the bird. You were in shock, completely spent. And when I woke up in Germany, they told me everyone survived. All 6, and I felt nothing. No relief, no pride, just emptiness. That's trauma, Sam. That's what carrying that weight does. So I left, requested discharge. They tried to talk me out of it, offered promotions, positions, but I couldn't stay. Every time I closed my eyes, I was back in that compound. Wade reached for her hand. She let him take it. You know what I did after I recovered? He said quietly. I went back, did 2 more tours, retired 3 years ago, and the whole time I carried guilt. Sam looked up. For what? For not finding you. For not telling you what you meant to us, to me. His voice broke. You saved my life, Sam. You saved all of us. And I never got to thank you. Never got to tell you that what you did that day was the most extraordinary thing I've ever witnessed. Tears welled in his eyes. I've led men into combat for 30 years. I've seen bravery. I've seen sacrifice. But I've never seen anyone fight as hard as you did to keep us alive. Sam's throat tightened. I was just doing my job. No, you were doing something most people can't even imagine, and you've been running from it ever since. She pulled her hand back, stood, walked to the window. I don't want to be defined by that day. Then don't be, but don't hide from it either. Wade's voice grew stronger. You have a gift, Sam, a skill that saves lives, and the world needs that. This hospital needs that. I'm not that person anymore. Yes, you are. I saw it tonight. The way you moved. The way you knew exactly what to do when no one else did. That's still you. Sam turned. Her eyes were wet now. I left because I thought I could escape it. The pressure, the fear, the weight of knowing that if I made one mistake, someone died. And did you escape it? She shook her head. No, it followed me. Every patient, every case. I still feel it. Then maybe you stop trying to escape and start using it. Because what you carry isn't a burden, it's a purpose. Before she could respond, the door opened. Pemberton stepped inside. His face was grave. Dr. Graves, we have a situation. Sam wiped her eyes quickly. What is it? The rebar patient. He's crashing again. Different issue this time. We think it's a pulmonary embolism. Massive. He's not responding to anticoagulation. Sam's mind shifted instantly, back into focus. Where is he? Trauma 1. Mansoor's with him, but he's out of options. The clot is too large, too proximal. Sam was already moving toward the door. Wade called after her. Gravedigger. She stopped, turned. Go save him. She nodded, left, ran through the hallways, down 2 flights of stairs, through the ER, burst into Trauma 1. The kid was on the table, skin ashen, lips blue, monitor showing a rapid, thready pulse. Mansour was at the bedside, hands pressed to his temples. He's not perfusing. The clot is blocking the main pulmonary artery. I've pushed TPA, but it's not breaking it up fast enough. He's got minutes. Sam stepped forward, looked at the monitor, the ultrasound screen, saw the clot, massive, right at the bifurcation of the pulmonary artery. We need to extract it. Mansour stared at her. Surgically? That requires cardiopulmonary bypass. We'd need to open his chest again, put him on a heart-lung machine. We don't have time for that. Then what are you suggesting? Sam's eyes didn't leave the screen. Catheter-directed embolectomy. We go in through the femoral vein, thread a catheter up to the clot, extract it manually. That's extremely risky, if we dislodge it wrong. He dies anyway. Mansour hesitated. Sam's voice was calm. Absolute. I've done this before, twice. Both in field hospitals. Both times the patient survived. This isn't a field hospital. No, it's better. We have imaging. We have equipment. We have backup. She turned to the room. Lena, Joel, 2 other nurses. I need a vascular access kit, guide wire, aspiration catheter, and get interventional radiology on the phone. Tell them we're doing this here, now, and we need their equipment in this room in 3 minutes. Joel moved. Sam pulled on gloves, looked at Mansour. I need your hands again. You're going to guide the catheter while I navigate. We do this together. He stared at her, then nodded. The equipment arrived. Sam prepped the femoral site, inserted the catheter, watched the screen as it threaded up through the venous system. Her hands were steady, her voice was calm. Advancing past the iliac, into the inferior vena cava, approaching the right atrium. The catheter moved on the screen, millimeter by millimeter. Entering the pulmonary artery, see the clot. She adjusted the angle, advanced further, positioning the aspiration tip. Mansour, on my mark. Activate suction. He gripped the control. Ready. 3, 2, 1. Now, the suction engaged. The screen showed the clot fragmenting, pieces pulling into the catheter. The patient's oxygen saturation started to rise. 70%, 75, 80. The monitor beeped. The rhythm stabilized. Color returned to the kid's face. Sam pulled the catheter back slowly, carefully. We're clear. She removed the line, applied pressure to the site. The room exhaled. Mansour stared at the monitor, then at Sam. Where the hell did you learn that? Sam stripped off her gloves. Her hands were shaking now, just slightly. Forward Operating Base, Kandahar, 2013. Soldier had a massive PE from a long transport. No way to get him to a surgical facility in time. So I improvised. She looked at the kid, his chest rising and falling, steady now. He lived, just like this one. She turned to Lena. Monitor him closely. Any change, page me. Then she walked out. Pemberton was in the hallway. He'd been watching through the glass. That's 3 times tonight. Sam didn't stop walking. I'm going home. Sam. She stopped, turned. Pemberton's face was different now. Respect, awe, something deeper. You just saved that kid 3 times in one night, using techniques most surgeons have never even heard of. That's not luck. That's mastery. That's desperation. No, that's who you are. Sam's voice was quiet. I don't know who I am anymore. Then maybe it's time you figured it out. She left. Walked out of the hospital into the cold night air, stood in the parking lot, alone. And for the first time in 10 years, she let herself cry. Sam didn't go home. She sat in her car in the parking lot for 2 hours, engine off, windows fogging, watching the hospital through the glass. The place she'd been hiding in for 6 months. The place that had just forced her to stop hiding. At 4 a.m., she went back inside. The ER was quieter now. The mass casualty chaos had settled into the routine hum of overnight medicine. Joel was at the nurse's station. He looked up when she walked in. Thought you went home. Couldn't sleep. He nodded, didn't push. The kid's stable, still in ICU. Mansour's up there now, hasn't left his side. Sam poured herself coffee from the station pot. It was burnt. She drank it anyway. Colonel Wade's asking for you again, Joel said quietly. I'll go up. Sam. Joel's voice stopped her. What you did tonight, that wasn't just good medicine. That was something else. She looked at him. I've been in emergency medicine for 20 years, he continued. Navy, civilian. I've seen a lot of doctors, a lot of trauma. but I've never seen anyone move the way you do, like you're 3 steps ahead of everyone else. That's just experience. No, that's survival instinct, the kind you only get one way. Sam didn't respond. Joel leaned forward. I looked you up. Silver Star. Helmand Province, August 14th, 2014. You kept 6 soldiers alive under siege for 11 hours. It's public. Public record. Yeah, but what's not in the record is why you left. Why someone with your skills ended up in a teaching hospital instead of running a trauma program somewhere. Sam set down the coffee. Because I was tired of war. Were you? Or were you tired of carrying it alone? She met his eyes. Joel's voice softened. I was a corpsman. I know what it's like. Coming back. Trying to fit into a world that doesn't understand what you've seen. Pretending you're fine when you're not. I am fine. You saved 3 lives tonight using techniques you learned in combat. You're not fine. You're functioning. There's a difference. Sam looked away. The thing is, Joel said, you don't have to carry it alone anymore. People here see you now. They know what you're capable of. And they want to learn from you. I'm not a teacher. Maybe you should be. Before she could respond, Pemberton appeared in the hallway. He wasn't alone. Dr. Mansour was with him. And behind them, 2 people Sam didn't recognize. A woman in business attire. A man in a suit. Pemberton approached. His face was serious, but not unkind. Dr. Graves, we need to talk. Conference room, now. Sam followed them. The conference room was cold, sterile. A long table with too many chairs. The woman in business attire extended her hand. Dr. Graves, I'm Dr. Ellen Voss, Chief Medical Officer. Sam shook her hand. The man in the suit spoke next. Richard Chen. Hospital Administration. Legal Counsel. Sam's stomach tightened. Legal. Pemberton gestured to a chair. Sit. She sat. Voss opened a folder, slid it across the table. Dr. Graves, we've reviewed the events of the past 12 hours. 3 critical interventions. All successful. All involving procedures that are not standard protocol for civilian emergency medicine. Sam's voice was steady. The patients are alive. Yes, they are. And that's why we're here. Chen leaned forward. Dr. Graves, you performed an emergency thoracotomy in the ER. A controlled corridor extraction of a penetrating foreign object. And a catheter-directed pulmonary embolectomy. All without prior authorization. There wasn't time for authorization. We understand that, Voss said, and we're not here to reprimand you. Sam blinked. Voss continued. We're here to offer you a position. Silence. Mansour spoke. After what I saw tonight, I went to Dr. Voss. Told her we have a resource we're not using. A skill set this hospital doesn't have. And we need to change that. Pemberton nodded. I spent 6 months underestimating you, Dr. Graves. That was my failure. But after tonight, I understand what you bring to this institution. And I think we'd be fools not to utilize it. Voss slid another document across the table. We're proposing a new program. Trauma Innovation and Combat Medicine Integration. You would be the director. Your role would be to train our staff in advanced trauma techniques. Teach them what you know. Build protocols around the skills you've developed. Sam stared at the document. You'd have full autonomy, Voss continued. Your own budget, your own team. And you'd still work clinically, but with the authority to implement techniques that fall outside traditional guidelines. Why? Because you saved 3 lives tonight that no one else could have saved, Mansour said. And if we don't learn from that, we're failing our patients. Sam looked at Pemberton. You spent 6 months telling me I didn't belong here. I was wrong. His voice was firm, sincere, and I'm sorry. You belong here more than anyone. She looked back at the document, read the title, Director of Trauma Innovation. Her hands rested on the table. She saw the edge of her tattoo beneath her sleeve. 33.0125 degrees east. 64.3595 degrees east. Helmand. August 14th, 2014. The day she thought ended her. Voss leaned forward. Dr. Graves, I know this is sudden, and I know you have reasons for keeping your background private. But what you did tonight proved something. You're not just a good doctor, you're a transformative one. I don't want recognition. This isn't about recognition. It's about impact. It's about making sure the next doctor who faces an impossible situation has the tools you have. Sam's throat tightened. I need time to think. Take the time you need, Voss said. But know this. We're not asking you to relive your past. We're asking you to use it. There's a difference. The meeting ended. Sam walked out into the hallway. Lena was waiting. She looked nervous. Dr. Graves? Sam stopped. I just wanted to say thank you for letting me watch tonight, for showing me what's possible. Sam's voice was quiet. You would have figured it out. No, I wouldn't have. Not without you. Lena hesitated, then continued. I looked you up. I know what you did. In Helmand. And I just want you to know that what you did tonight, saving that kid 3 times. That's the kind of doctor I want to be. Sam's eyes stung. Then keep learning, keep asking questions, and don't ever stop fighting for your patients. Lena nodded, walked away. Sam stood alone in the hallway, pulled up her sleeve, looked at the tattoo, the coordinates, the call sign, a date. She'd spent 10 years trying to bury it. But maybe Wade was right. Maybe it wasn't a burden. Maybe it was a purpose. She walked to the ICU. Colonel Wade was awake, sitting up, reading something on a tablet. He looked up when she entered. Heard you got offered a job. Sam smiled faintly. News travels fast. It's a small hospital. He set the tablet down. You going to take it? I don't know. Why not? Because I'm not sure I'm ready to stop running. Wade's expression softened. Sam, you've been running for 10 years. And where has it gotten you? She didn't answer. I'll tell you where, he continued. It's gotten you to a place where you saved 3 lives in one night, using skills most people will never have. And now you have a chance to pass those skills on, to make sure other doctors can do what you do. What if I fail? Then you fail. But at least you'll fail trying. That's better than hiding. Sam sat down beside his bed. I've spent so long trying to forget Helmand, trying to be someone else. You can't be someone else. You can only be who you are. And who you are is someone who doesn't give up. Ever. His hand reached for hers. You didn't give up on me, on any of us. And I'm not going to let you give up on yourself. Tears welled in her eyes. I'm scared. Good. That means you still care. She sat there, silent, letting the weight of 10 years finally settle. Then she stood. I need to go. Where? To accept a job. Wade smiled. That's my gravedigger. Sam walked back to the conference room. Voss was still there, reviewing documents. She looked up when Sam entered. Dr. Graves. Sam's voice was steady, clear. I'll take the position, on one condition. Name it. I want to build a program that trains both civilian doctors and transitioning military medics. A bridge between combat medicine and civilian trauma care. Voss smiled. Done. Sam signed the contract. And for the first time in 10 years, she felt like she could breathe. 6 months later, the conference room on the 4th floor had been transformed. What used to be storage space was now the Trauma Innovation Center. Whiteboards covered the walls, filled with diagrams of surgical techniques, protocol flowcharts, and anatomical drawings. A simulation lab occupied the back corner, complete with mannequins and medical equipment. Sam stood at the front of the room. 20 people sat in rows facing her. Residents, attendings, nurses, paramedics, and 3 former military medics, newly transitioned, still finding their footing in civilian medicine. She held up a diagram of a chest cavity. When you're dealing with a penetrating thoracic injury in a resource-limited environment, your priority isn't perfection, it's stabilization. You're buying time, that's it. She pointed to the subclavian artery. This vessel here, if it's compromised, you have minutes, not hours, minutes. And if you're waiting for an OR, for a cardiothoracic surgeon, for ideal conditions, your patient dies. One of the residents raised a hand. Ben Holloway, the one who used to gossip about her in the lounge. He didn't gossip anymore. Dr. Graves. How do you make that call? How do you know when to go outside protocol? Sam set down the pointer. You know because you've trained for it. Because you've practiced the technique enough times that it's not a gamble, it's a skill. That's what this program is about. Giving you the skills so that when the moment comes, you don't freeze, you act. She moved to the simulation mannequin. Lena, come up here. Dr. Lena Parks stood. She'd been promoted to chief resident 2 months ago. She moved to the front. Sam handed her a scalpel. Show me the emergency thoracotomy approach. Lena's hands didn't shake. She positioned the blade, made the incision, smooth, controlled. Good. Now talk me through your next steps. Rib spreader. Access the thoracic cavity. Identify the source of bleeding. Clamp if vascular. PAC is parenchymal, and if you can't identify the source, cross-clamp the aorta. Buy time until definitive repair. Sam nodded. Exactly. She looked at the room. A year ago, none of you would have known how to do this. Now it's second nature. That's progress. A voice came from the back of the room. Dr. Graves. Sam looked up. One of the former military medics, a woman in her early 30s, Sarah Ortiz, former Army 68W, 2 deployments, medically retired after an IED injury. She'd been quiet for most of the training, hesitant to speak up. Yes, Sarah. I just wanted to say thank you for this program. For getting people like me a place to land. Her voice wavered. I spent 8 months after discharge thinking I didn't belong anywhere, that everything I learned didn't matter anymore. And then I found this program, and I realized it does matter. It all matters. Sam's throat tightened. It always mattered, Sarah. You just needed people to recognize it. The room was silent. Sam cleared her throat. All right, we're done for today. Practice your suturing. Practice your access techniques. And remember, skills fade if you don't use them. Stay sharp. The room emptied slowly. Lena stayed behind. Dr. Graves, I got the results back from the simulation assessment. Our residents scored in the 94th percentile nationally for trauma response time. Sam smiled slightly. That's good. That's unprecedented. Lena set down the tablet. You've built something incredible here. We built it. You, Mansoor, Joel. All of us. But it started with you. Sam looked at the whiteboard, the diagrams, the protocols. It started because I stopped running. Lena hesitated. Can I ask you something personal? Go ahead. Do you still think about Helmand? Sam was quiet for a moment. Every day. Does it still hurt? Yes. But it doesn't control me anymore. Lena nodded. That's growth. That's survival. Sam's pager buzzed. She looked down. ICU, Colonel Wade. She walked through the hospital corridors. They felt different now, lighter. People greeted her. Residents asked questions. Nurses thanked her for the new protocols. She wasn't invisible anymore. Wade was in a chair by the window when she entered. He'd been discharged months ago, but came back weekly as a volunteer patient advocate, talking to veterans, helping them navigate the system. He looked up when she walked in. Sam, Marcus. They'd moved to first names 3 months ago. How's the program? Growing. We just got approval to expand to other hospitals in the network. Wade smiled. I'm not surprised. You've changed this place. We've changed it. Don't deflect. This was you. Sam sat down across from him. I got a call yesterday, she said quietly. From? Walter Reed. They want me to consult on a new combat trauma training program. Help design the curriculum for field surgeons. Wade's eyes widened. That's incredible. It's terrifying. Why? Because it means going back. Not physically, but mentally, emotionally. Wade leaned forward. And? Sam exhaled slowly. And I think I'm ready. He reached across, took her hand. I'm proud of you. Her eyes stung. I couldn't have done this without you. Yes, you could have. You just needed someone to remind you who you are. A knock on the door. Pemberton stepped inside. He looked older now, softer. Sam, sorry to interrupt. It's fine. He held up a folder. The board approved your proposal. Full funding for the next 3 years. National expansion. And they want you to present at the American College of Surgeons conference next month. Sam blinked. They want me to present? Your outcomes speak for themselves. Mortality reduction, faster intervention times, improved resident confidence. You've created a model other hospitals want to replicate. She took the folder, opened it, saw her name on the cover page. Dr. Samantha Graves, Director, Trauma Innovation and Combat Medicine Integration. Pemberton's voice softened. I owe you an apology for how I treated you when you first arrived. I didn't see you. I didn't value you. And that was my failure. You've more than made up for it. No, I hadn't. But I'm trying. He paused. You've changed the culture here, Sam. You've made us better. And I'm grateful. He left. Wade smiled. Looks like you're not running anymore. No, I'm not. So what now? Sam looked out the window, at the city beyond, at the sky. Now I teach. I build. I make sure no one else has to carry what I carried alone. That's a good mission. It's the only one that matters. Her pager buzzed again. Trauma alert. Multi-vehicle accident. Inbound. She stood. Wade watched her. Saw the shift. The focus. Go. She moved toward the door. Stopped. Turned back. Marcus. Yeah. Thank you. For not letting me hide. Thank you for saving my life, twice. She smiled, then left, ran down the stairs, through the ER doors. The chaos was already building. Voices shouting, gurneys moving. But Sam didn't feel the panic anymore. She felt clarity. She stepped into the trauma bay, pulled on gloves. Lena was at her side. Sarah Ortiz was there too, observing, learning. The first gurney rolled in. Sam's hands moved, assessed, directed. Lena, take the airway. Sarah, start a line. I need trauma labs and imaging now. They moved as one, a unit, a team. And in that moment, Sam understood something she hadn't before. Helmand hadn't broken her. It had forged her. And now she was using that strength to build something that would outlast her. A program, a legacy, a bridge between two worlds. She worked through the night, patient after patient, each one a reminder of why she was here. At dawn, she stood in the empty trauma bay, alone, pulled up her sleeve, looked at the tattoo. 33.0125 degrees Earth, 64.3595 degrees E. Gravedigger. August 14, 2014. She used to see it as a scar. Now she saw it as a map, a reminder of where she'd been, and a compass for where she was going. She rolled down her sleeve, walked out into the morning light, ready for whatever came next, because she wasn't running anymore. She was building, and she wasn't building alone. The end, but not the end of her story. Just the beginning of a new chapter, one where the weight she carried became the foundation she built on, one where survival became purpose, and purpose became legacy. Dr. Samantha Graves, combat surgeon, trauma innovator, teacher, gravedigger, the one who refused to let people die, and in refusing, taught others to do the same.